Hello, I'm Dr. Franck Yata. Thank you for joining us for the third episode of our series on erectile dysfunction. Today, we'll be exploring the causes in detail. If this is your first time joining us, I would ask you to start with episode number 1 instead. But first of all, please subscribe to our YouTube channel, like this video and every video you watch to support us. So, with that said, let's get back to the causes of erectile dysfunction. For each cause, we will make an effort to explain the pathophysiology that goes with it. That is, we will explain the disordered or abnormal functional mechanisms underlying the disorders discussed here. If we cannot exhaust them in this episode, we will continue to the next episode.
Yes, thank you, Doctor. Let's talk clearly, but let's talk briefly. Can you start with the causes, please?
Okay, we can classify the causes of erectile dysfunction into 4 groups that can act alone or in combination. These are organohormonal, psychological, drug-related, and mechanical or traumatic causes. But before going into detail about the causes, it would be more informative if you had an idea of how a normal erection is achieved. What is the sequence of events that leads to a normal erection? So that you can understand what is abnormal. We will call it the physiology of erection.
Very well, Doctor, so tell us about it. How things are normally done.
Okay, I'm going to start by showing you a video I found on the internet, YouTube channel Dar Alzacora, which I think describes what's happening relatively well. That way you'll have a visual idea before I go into detail. Let's watch.
Our circulatory system is composed of arteries, veins, and capillaries. The penis is one of the unique organs requiring a continuous blood supply to maintain its reproductive function. It is composed of 3 cylindrical spongy tissues, 2 corpora cavernosa, and 1 corpus spongiosum. During flaccid states, blood flow to the penis is low, and blood supply is insufficient due to the contraction of the trabecular smooth muscle fibers. Erection is a physiological process that generally begins with sensory and mental stimulation of the brain. These brain impulses cause the muscles of the corpora cavernosa to relax. The parasympathetic nervous system relaxes the vascular smooth muscles by releasing nitric oxide, which results in vasodilation. Blood flow and output increase, and the penis dilates, thus increasing its size. The expansion of the trabeculae prevents venous drainage by compressing the emissary veins between the 2 layers of the tunica albuginea. This traps blood and results in a full erection. This is called the passive veno-inclusive mechanism. Blood congestion occurs when blood flow increases and the helicon arteries straighten and dilate, allowing blood flow into the corpora cavernosa. Genital stimulation then induces a further increase in penile rigidity, called the bulbocavernosus reflex. Finally, after ejaculation, sympathetic innervation contracts the trabecular smooth muscles again. As a result, penile arterial blood flow decreases and venous drainage occurs, leading to a gradual evacuation of blood. The penis then returns to its flaccid state.
So, let's come back here and review all of this in detail. An erection begins with sensory and mental stimulation of the brain. The brain sends messages to the penis via nerves. The penis is made up of anatomically distinct smooth muscles that, once relaxed, have the capacity to expand. Messages from the brain then instruct these smooth muscles, especially the corpora cavernosa, to relax, allowing blood to flow and fill these bodies. The blood is then trapped under high pressure by a series of valves, thus creating an erection. In other words, it all starts with the brain, which is most often stimulated by a sensory receptor in the body, visual, tactile, olfactory, etc., and even by thought. The brain will then cause the vessels and cells of the corpora cavernosa to relax and expand to quickly receive more and more blood, thus increasing the size, volume, and firmness of the penis. At the same time, a mechanism of membranes and valves will prevent the blood from escaping, trapping it. This state will last as long as the desire and mental pressure are maintained in the brain. However, it should be noted that this desire and mental pressure seem to have a peak that should not be exceeded at the risk of triggering the ejaculation process. Usually, when this ejaculation process is triggered, it is irreversible. It will continue until the end, after which the erection process will also be reversed. At this point, the muscles in the penis will contract, cutting off blood flow. The pressure will decrease and the valves will open, allowing blood to flow out. The penis will then lose its erection and become flaccid or limp. So, we have just described the most common erections of the awake person. There are also spontaneous erections.